We've seen an increase in fatal drug overdoses across the United States that's really being driven by drugs like fentanyl. In 2020, the Western states in particular had the largest increases in fentanyl availability in the illegal drug market. And in our state, there was nearly a 70% increase in drug overdose deaths compared to 2019. Availability has only increased since then, and we suspect that this will lead to an increase in the number of overdoses. If you or someone you know is using drugs, there could be a higher risk for overdose. Counterfeit pills are especially risky. Fentanyl is a powerful opioid pain medication that is similar to morphine, but is 50 to 100 times stronger. Pharmaceutical fentanyl is prescribed for severe pain and anesthesia, but fentanyl is also illegally manufactured and distributed, often mixed with other drugs. There is a high risk of overdose with fentanyl. It can cause breathing to slow or stop, which can cause brain injury or death. In illicit drugs, fentanyl is especially dangerous because people are often unaware that fentanyl has been added to the drug or pill. Fentanyl is being mixed in with other drugs, and these mixtures are being sold as Xanax, oxycodone, methamphetamine, heroin, and other substances. Unfortunately, though, mixing fentanyl with these other drugs greatly increases its overdose risk. There is no quality control in illicitly made drugs. The amount of fentanyl varies from pill to pill, even in the same batch. Only 2 milligrams of fentanyl can be fatal. When someone is overdosing from opioids or fentanyl, they can appear extremely sleepy or unresponsive, have very slow and shallow breathing, a faint pulse, pale or clammy skin, and limp body. They can also have bluish or pale lips and fingernails. An overdose can happen within minutes or over several hours. If you think someone is experiencing an overdose, dial 911 immediately. I recommend anyone who uses drugs or knows someone who does carry multiple doses of naloxone, which is also known as Narcan. Naloxone is a safe and effective medication that counteracts the effects of opioids and is an antidote for overdose. It is available at your local pharmacy. Just ask a pharmacist. And Oregon's Good Samaritan law also protects you if you give someone naloxone to save their life. Do not take any pill unless it's prescribed and given to you by a pharmacist. Assume any drugs that are purchased on the street, online, or given to you by a friend are not what they say they are and contain fentanyl. If you do use, make sure someone is with you so they can help you if you overdose. If you or someone you care about is using substances, there's also help. You can call the Alcohol and Drug Helpline, visit the Hawthorne Walk-In Center at the Hawthorne Farm Max Stop, or access the Washington County Provider List for substance use disorder treatment and peer services, which is on our website. One of the best ways to protect youth from substances is by having open communication and educating them on the risks of substance use. Trust your instincts. If you notice a change, ask about it. Talk to your teen and monitor their social media use. Substances are often offered by someone they know or someone they meet online. Resources for youth include the Oregon Youth Line, which you can text or call.